So President Cyril Ramaphosa has now moved the country to lockdown alert level 1. The easing of restrictions is in response to the end of the third wave of the coronavirus infections in the country, a sustained decrease in new daily cases, hospitalisations and deaths. Restrictions on public gatherings have been significantly relaxed, coinciding with increased election campaigning ahead of the polls on the 1st of November. So what are the likely implications for the spread of the virus and a fourth wave? Let's unpack it all for you. We're joined now by the Acting Deputy Vice-Chancellor for Research and Innovation at UKZN. That's Professor Mosa Moshabela. Prof, it's great to have you with us on the show this morning. And in so much as I suppose all of us are a bit relieved to go down to lockdown level 1 after months of quite stringent restrictions, there are major concerns that it's coinciding with elections and campaigning, and it's going to mean that more people are going to be gathering.
Yeah, absolutely. Good morning, Michelle, and to the viewers. I think indeed the relaxation of restrictions to alert level 1, they are most welcome, and I think even from an epidemiological point of view, we are indeed in a state where we can relax restrictions, given the fact that the caseload is so low now. We have exited officially the third wave nationally, and even the positivity rate is less than 5%. So this is really good news for the country, and this comes in the face of a devastating third wave and a devastating variant of Delta that in many ways we were very concerned whether we will come out of the third wave, and also we saw a long tail of delay coming out of the third wave. So indeed we are very much happy with this, but I agree that I think that the one thing in the speech by the president last night that was uncomfortable was the issue of the numbers of people in gatherings, especially the relaxation of indoor people, number of people from 250 to 750. Yeah. And this for us is a concern, given the fact that Delta, we know that it spreads well indoor, it's carried airborne indoor, and many of our buildings really don't have good ventilation. And so we're very concerned about that.
I mean, I suppose, Prof, it's now up to, number one, people to make their own choices, even though the restrictions do say 750 indoors, for people to make smart choices about where they gather. And the second issue is, of course, around those non-pharmaceutical interventions, ensuring that when you're gathered in a group of people, no matter how large, that you continue with social distancing, with wearing masks and with sanitizing. And certainly, from what we see on the campaign trail so far, it hasn't really been the case.
Yeah, I think that, Michelle, it's important for all of us to understand that the more numbers you have, they increase the risk of infection that spread. It takes 1 or 2 people in the room of 750 to spread to a whole lot of people, and especially because our vaccination rates are still low, so transmission is likely to happen. And so these are the things that, with due respect to the speech by the president, these are the risks that the president could have highlighted up front. To say that, we've got these reasons to increase the numbers to the levels that were increased to, but the risk is real. Please ensure that you limit as much as possible. And for us, I think in the sort of public health sector, we would feel more comfortable with that message being clear to the nation that as much as possible, let's make sure that we keep the numbers low. Let's make sure that we follow all precautions necessary. We ventilate, we meet outdoor as much as possible so that we don't have a resurgence. Because the moment there's a resurgence, the numbers are high. We will have no choice but to start to increase the restrictions again, and we should not sabotage ourselves like that.
Yeah, absolutely. Prof, you've talked to us about the third wave and the fact that we, at one point we were worried about when we would exit the third wave of infections. The information that I have here is that it lasted 130 days. That was the third wave in our country. We saw peaks of 20,000 cases a day. Those numbers are significantly decreased now. But of course, what's on our minds now is what's in store for us in the fourth wave of infections?
Yeah, no, absolutely. I think that we are concerned about a surge of infections, and by all indications, looking at the trends in South Africa of how this the virus has been moving and kind of evolving, and what we have seen throughout the world, and what we know of historically of how this virus tend to behave. We can really prepare and accept that we are going to face a surge of infections at some point. I think the issue really is we don't know when those infections will begin to surge, because that depends on our own behavior, the extent to which we observe public health measures and precautions, the extent to which all these gatherings will contribute to transmission of infection depends on the kind of variant that we will be facing at the time. It could be Delta, it could be another variant, and we expect that it might be some other variant. And so it depends on how far we are with our vaccination rollout and how we can quickly ramp up vaccination. And I think that all of those factors will determine whether we are seeing a surge of infections earlier in the form of a fourth wave or later. But we can, predict that it would be probably around December, either earlier or later, depending on all these factors. So with all these, measures that were outlined yesterday, we are beginning to worry that there is an increased chance now of infections beginning to spread, because they can lead to complacency, and this is our biggest concern. And also at the same time, our vaccination rollout has really come down in terms of daily numbers. We are not doing that great.
Yeah,
and so the prospects that we had to be in a better place later are limited now.
Yeah, absolutely. In fact, the numbers this week, Prof, I've been monitoring the numbers from the NICD every day. It's been at around 150,000 a day. It's much, much lower. I think in the single thousands over the weekend. Our aim is 300,000 vaccines administered every single day. In fact, at one point, the President did say we were hoping to get to the point of 400,000 vaccines administered a day. So today we're launching the Vuma Vaccination Weekends campaign, and it's to address that very issue of the low vaccine numbers, particularly that we're seeing on weekends.
Yeah, absolutely. And there was a nuance in something the President said yesterday about the 250,000 target of new people coming in for vaccination. So that 250,000 that we have to meet every day during the week until the 16th of December in order for us to reach the target of 70% is for new doses, which means that on top of that, you have to add all the people that are coming back for second doses in order to really look at what should be the real target for the day. And I agree that right now it's probably above 300,000. And so, yeah, there's something concerning about what should be the target and what is the reality at the moment. And I think the campaign that is being introduced, in my view, it should run every day, not just on weekends. It should run every day, and it should run across political spectrum so that there is consensus amongst our leaders. It should also include, of course, as stated, all the other leaders in other sectors, including community leaders. It will really help if we are all singing from the same hymn page.
Yeah, absolutely. And perhaps this issue of a vaccine passport will get people to vaccine centers if it is a prerequisite that you have this passport to access certain events, certain services.
Yeah, so the President changed to vaccine certificate. Personally, I'm very happy with that change, because what it does is it represents the essence of the fact that it's a medical record. Just first and foremost, it's a medical record that confirms vaccination. How it's then used is another factor. And so primarily, I think the vaccine certificate, it becomes your proof of vaccination, your record of vaccination. And with it, you can actually be able to use for many other factors, including if you've got issues later, you can use this record. But I think that really it is something that society needs to keep negotiating in terms of how far we can go in using the vaccination certificate to implement vaccine mandates. I'm concerned about the lack of clarity around how this is going to work, and a lack of debate, really, because then vaccine mandates are coming. We don't really have a choice. At least when it comes to travel, that's guaranteed. And also, we know that people are starting to talk about them in places where there is high risk. Those things become really important. And I think it's only fair to South Africans that, we put a clear proposal forward on what those mandates might look like. The vaccine certificate is accepted, it's okay. We need it regardless of whether we've got vaccine mandates or not. But it's indeed important that we start talking about what kind of vaccine mandates we are looking at for South Africa.
Yeah, absolutely. We're certainly getting to a stage now for businesses in particular, for example. Let's talk about restaurants, for example. If I'm going to dine at a restaurant, I would like to know that the staff have been vaccinated, or all of your patrons have been vaccinated.
Yeah, and I think that it's also fair to say that, this is in keeping with international practice. But I think even though we want to adhere to international practice, we also have to face the reality of our own context and make sure that we accommodate the flaws that we have in our society, inequality, and so many other factors in implementing the vaccine mandates. Yeah. So absolutely, I think the principle could be that let's make sure that the patrons are vaccinated. Let's make sure that we're creating safe spaces to the extent possible. But if we are going to do that, how are we then going to accommodate people who are not vaccinated? We need to answer those. Yeah. So if there are restaurants, for example, that would accommodate people who are not vaccinated, then it's fine. We can do that. But we need to negotiate all that, all those issues openly, I think.
Yeah, absolutely. Professor Moshabela, it's always a great pleasure talking to you. Thank you so much for your time this morning on the AM Report. He is Acting Deputy VC for Research and Innovation at UKZN.